Dr. Osagie Ehanire, Minister of Health, has expressed concern over the increased rate of breast cancer in the country and urged women to go for regular screening. Ehanire made the call at the opening of the 2020 edition of the annual International Cancer Week in Abuja. He said reports from the Nigerian National System of Cancer Registry show that breast cancer in Nigeria increased significantly between 1960 and 2016.
The strategy of the Ministry of Health is underpinned by primary prevention initiatives to reduce incidence through awareness creation, risk communication for reduction of risk factors such as carcinogens, and also self-examination and routine medical examinations. This is the most cost-effective and helpful approach. I'm particularly pleased that activities for the 2020 International Cancer Week include the launch of some important documents. It's my expectation that stakeholders will find them useful as we work together to actualize the goal of eliminating cervical cancer by the year 2030, in line with the WHO declaration.
In her address, Mrs. Pauline Talin, Minister of Women Affairs, represented by Mrs. Funke Oladipo, Acting Director of Women Affairs, said the ministry will continue to provide awareness for women and girls and work with all relevant bodies in the fight against cancer.
We continue to provide awareness for women and girls and work with all relevant bodies to achieve these mandates. The ministry is committed to improving the social health status of women, girls, and children, and we continue to partner relevant ministries, departments, and agencies, civil society organizations, as well as development partners in the development of programs and projects aimed at enhancing the health status of women, addressing collective strategy at addressing the cancer problem, including a multisectoral approach to improve reproductive and health challenges confronting women is key in our plan.
Also, Dr. ZAINAB BAGUDU, Chief Executive Officer, MEDICAID Cancer Foundation, said one main takeaway from the COVID-19 pandemic was a wake-up call on the need for improved healthcare infrastructure.
As we have heard, the main takeaway from this pandemic, the COVID-19, has been a wake-up call on the need for an improved healthcare system and infrastructure, as well as the urgency and importance of addressing the plight of not just patients with chronic diseases, but indeed cancer patients, survivors, and their caregivers. At a risk of